Okay. So welcome to Black Mental Health Matters. My name is Dr. Jimenez. I will be joining you all today as the host for our talks today on mental health and holistic treatments. It's holistic treatments for mental health and also for some coping tools. I will be joined by some amazing guests. So we have Martina and Cynthia who will be joining us soon. So let me add her. So, hi, Cynthia. Can you hear us?
Yes, I can hear you fine. Can you hear me?
Yes, excellently. If you have headphones, it will work the best so there won't be any connection issues. So, if you have headphones, that would be great. So, what I'm going to do now is I'm going to start and introduce you all. So, a little bit about myself. My name is Dr. Jimenez. I'm a clinical psychologist here in the West Coast. I'm originally from the Caribbean. I've been practicing psychology for the past 10 years. I work in big medical centers, also private practice, and I have practiced in the Caribbean, the East Coast also, and now the West Coast of the United States. I am a trauma psychologist, and I also specialize in holistic mental health treatments as well. So I'm very integrative. So welcome, Martina. Can you please introduce yourself and let us know a little bit about yourself? And we'll do the same with Cynthia and once our other um, guests. And if I say the names wrong, please correct me. I know all of us are from many areas of the world. So, welcome, Martina. Can you tell us a little bit more about yourself, an introduction?
Yes, sure. So I'm Martina. I'm a cognitive behavioural psychotherapist. I'm based in the UK. I've worked in kind of mental health wellbeing for over 20 years. I'm passionate about it. I'm passionate about using my knowledge to help my community and to help, other cultures and races as well. I'm also looking at creating an app, Black Mental Wealth, for Black and mixed individuals, because I acknowledge that in the African Caribbean community that we don't necessarily reach out for support. So you've got to think outside of the box.
Mm-hmm.
And I'm passionate about resilience. That is my focus. I'm a published author. I've published a book called Resilience in the Workplace. And it's fantastic to be here with you all.
Thank you. Thank you so much. So, Cynthia, tell us a little bit more about yourself. Can you hear us, Cynthia? So maybe
My
I'll.
internet connection seems to be very weak. I am so sorry.
No worries, no worries. I was able to hear you now. Can you tell us a little bit more about yourself, Cynthia? Um,
Yes, hi. I'm a recovery technician right now in behavior health. Currently working on my doctorate in health psychology. My main emphasis right now is on African American women and mental health for them. My doctorate is showing how the need, we have such a need for Black counselors, especially,
mhm,
is showing that we're willing to go and seek counseling, but we really need to find more that look like ourselves.
mhm,
And mindfulness is such a huge thing in behavioral health, especially in substance abuse.
mhm,
Sleeping is such a problem for them, and I am finding that meditation, and I run a meditation series with at
mhm,
night, that it really
mhm.
helps be able to sleep better. Many of them are on several different medications, so the meditation helps them to calm down and be able to sleep better at night.
Excellent. So thank you and welcome. Ayumiri, how did you pronounce your name so I won't be saying it incorrectly? So
Thank you.
welcome.
Okay, thank you. It's actually Ayomide. Ayomide is a Yoruba
Ayurveda.
word. Yes.
Okay.
Thank you.
Excellent.
So,
Can you tell us a little bit about yourself?
okay. Ayomide Rutolagbenga. I'm studying for my master's in biology right here in South Africa. So I'm a food scientist and technologist too. That was what I did in my first degree. And I'm passionate about mental health because I see that we need more discussion on this. It's not just something that has to be within the four walls of the hospital. So I think we should take mental health to everywhere so that people can be more conscious and get better with it. Thank you.
Excellent, excellent. So, to our guests here, so when you hear the word holistic mental health and holistic psychology, what are some of the things that come to mind to you?
Mm. Holistic means like the whole, everything all together. So it's not just you're not just even discussing just mental health. It means the general health. Every part of the human, lifestyle, social, culture has to be involved to make this, perfect, to give us the perfect mental health well-being we need.
Excellent. And for you, Martina, when you hear the word holistic mental health, what do you think about, or what is that concept for you?
So for me, it's about kind of treating the whole system, acknowledging that we're not just physical beings, entities. We've all got. I mean, I'm a Christian. I believe that we've got. There's a spiritual side of us. Some people may have a faith, some may not, but you can practice spirituality in different ways. So acknowledging that the mind, the psyche, and then also the physical body, and looking at catering to all of those areas because they're all interconnected. You can't focus on one area and ignore the other. Otherwise, someone's mental health will be compromised. So it's about focusing on the whole
Yes. And
person.
that's also how I see it. Also, holistic is seeing the whole together. I know that historically in the healthcare system, we see a doctor for the body, a doctor for the mind, and everything is not connected. So, a quote that I always love is, "The whole is greater than the sum of its part." It's everything is connected, like you said. To me, the mind, the body, and even the spirit. I know for a lot of us who are Afro descendants, whether we practice many spiritual belief system, and that's also highly important to bringing about wellness. And I think it's important to know the person's cultural background too, and race, and how some discrimination, how the impacts of inner city violence and slavery and cultural components also, to integrate them. So that's also, to me, it's very integrative, and looking at all these pieces to better understand the person. For example, I deal with clients who have PTSD, post-traumatic stress disorder. Many of them have been sexually assaulted, been in the experienced combat trauma. Um, but we see that their physical health has also been impacted by their mental illness. For example, when somebody's always on fight or flight mode, eventually, that can lead to cardiovascular issues. We also know from the A study, um, we also know from the A study, which is a childhood adversive reactions, that there's some traumatic events that happen in childhood that then make somebody more prone to mental health difficulties or physical difficulties. But if they can be addressed, the person will be better able to cope. Um, so yes, definitely. So my next question is, have you guys heard of the concept of mindfulness? And so we can start with maybe Cynthia. I think you kind of mentioned mindfulness. So what is some, let me see something. I think we have some noise trouble. Um, oh, it's not letting me mute. So for you, Cynthia, what is mindfulness, and how do you utilize it in your services?
Looks like she lost
Frozen.
connection. Yeah.
Yeah, no worries. What about for you, Ayurveda? Have you ever heard of the concept of mindfulness, or what are some, if not, what are some holistic methods that you have integrated to care for your mental health or within your research?
Okay, I believe being mindful of our mental health involves not ignoring it. When we see some signs or some things that we just know, okay, this is not usual. This is not how it's supposed to be for my health. I think we should not ignore it. We should face it. That is one major way of getting the needed help. You know, being very confident to face what we are going through.
Excellent. And for you, Martina, what is mindfulness to you, and what are some of the how have you utilized that such methods in your own practice, or and for your personal self too?
Yeah, so I use mindfulness quite well. It's kind of part of my practice as a cognitive behavioural therapist, and I guess mindfulness is a third wave therapy. So I practice mindfulness-based cognitive therapy, and then use kind of individual mindfulness strategies and techniques with most kind of young people and adults that I work with. And for me, mindfulness, it's that kind of awareness that arises when you're kind of paying attention to the present moment. So it's about tuning out all of the noise, all of the distractions, and just being present, taking a non-judgmental stance. So if we're kind of bombarded by lots of worries, we're here now.
Yeah.
It's about kind of ignoring what's going on around you and just tuning in to what's being said and engaging all of your senses in the present moment. And all the research shows that it's highly effective in, reducing stress, anxiety. It's great for physical health as well. And the way I integrate it into my life is sometimes when I'm a bit stressed, and just kind of stopping in the moment and just focusing, just like using the grounding exercise, focusing on what's around me, what can I see, what can I hear? And then maybe when I'm going for a walk, like during COVID, I was doing a lot of walking. So walking in a mindful way, just taking in nature, the environment, and it just helps you to be still. And it's like, life is good because sometimes you're doing something, but you're not fully immersed in it. So you're not experiencing the benefits. So I'm a big kind of supporter of mindfulness, and I think you can adapt it into your life, brushing your teeth in a mindful way, eating in a mindful way, exercising in a mindful way. I think you just got to make it work for you and adapt and know yourself really, and which of the strategies work for yourself.
Yes, excellent. So for you, Cynthia, you mentioned mindfulness earlier. So for you, how do you define mindfulness, and how do you use it for your personal self and also within your clinical work? Because I know when one is a holistic provider, it's highly important also for us to practice it ourselves, right? Because then we're better able to explain it and utilize it.
Oh, you are so true on that. If you're not practicing it yourself, show others how to do that. And I'm going along with what Martina was, and it's in the little things, deep breathing, just the breathing in and this taking environment, and also earlier on diet in African American men and our eating, and we just putting food into our mouths and not even recognizing the textures and the smell, and it's the mindfulness of that, just enjoying that meal, taking your time, deep breathing, taking in the environment, because a lot of times we're just eating and we don't even know why we're eating. And especially in my work with talking with my clients, sometimes they're upset and they don't even know why. So I have them, okay, let's sit a second, just cleansing breaths, and maybe what I'm upset about is not really what I'm upset about. Maybe it's something else, and then we're able to get to the root of the problem. But mindfulness is taking in all of that, slowing down.
Excellent. Yes. So, and I'm in agreement with everyone, right? And on the importance of utilizing it for our own mental health. So, and particularly for me, mindfulness simply just means being aware, right? Being aware of the here and the now without judgment, being aware of the mind, right? Awareness of our body. And also, if we are spiritual, right, of our spiritual sense. And for me, spirituality, it's higher self, right? But for everyone, that might be a little bit different. So when we're mindful, we're in the here and the now. A lot of the times, what tends to happen, right, with mental illness, for example, in the context of trauma, the reason why I use trauma is because within the United States, about 70% of the population has experienced trauma. Also, being someone from the Caribbean, there's a lot of trauma. It's just that we put it under the rug. So I know in the African diaspora, we are always told, right, to just focus on the now and sometimes sweep everything under the table. But there's so many traumas that then get manifested, whether it's through substance issues, eating disorders, weight, also through other medical conditions such as cardiovascular. So mindfulness is just a practice that teaches us how do we ground the mind in the here and the now. And we notice what's happening, but without judgment, because we're also very judgmental. We might say, oh, I've been in treatment for 5 years. I'm not supposed to have those thoughts, or I'm a psychologist, or I'm in mental health. I shouldn't think like that. No, we all have intrusive thoughts. We all have engaged in behaviors that might have been, whether it's workaholic, eating, and all these things. We have engaged in behaviors, but how can we become aware of them without judging them, right? And compassion. So it might be, oh, I'm having a thought of anxiety versus saying I'm anxious, because you are not anxiety. Anxiety is a state, not who you are, or not, you're not a diagnosis. So that's why, like, all of you were saying, you can bring mindfulness into all areas of your life, because right now we could be mindful about being here, present and aware, without thinking about the connection or what we have to do next. So it's a practice in myself. The way that I practice mindfulness is I have a meditation practice. So when I wake up early, when I wake up in the morning, I try to at least have 11 minutes before I start seeing patients to kind of do. And there's different types of mindfulness, right? Like somebody said, walking, it can be eating. It's just being aware. So for me, I just become aware of the breath. And I use that as a grounding method to get myself grounded before seeing, clients, because it's dealing with trauma. It can be intense sometimes, and I know substance and anyone that is in the mental health field. So I try to, and if I don't have the opportunity to meditate, I also integrate it into my therapy, right? I always help clients. That's the first thing that I teach them, mindfulness, right? What are some techniques that they can utilize to be in the here and the now? Because usually PTSD is about what happened in the past and how can I avoid it in the future. Depression, a lot of the times, is about what happened in the past and you're stuck there. And anxiety is about the future. But what we lose sense is of the present moment. So mindfulness just means, how do you bring awareness back to the here and the now? So that's what, for me, mindfulness is, and I integrate that to everything. My next question is, so for you, what are some holistic methods that you utilize in your own practice? Whether that, I have heard mindfulness, or whether that is nutrition, whether that is, so what are some holistic methods, and also something that might be culturally relevant? Because I know that a lot of the times for our communities, they might feel like, oh, unfortunately, the mental health field in the US is very dominated by the dominant group. Like, I think Cynthia or Martina, somebody mentioned on how, sometimes our people are willing to come, but they feel like, would you understand me? So what are some holistic methods that you integrate into your practice? And also, can you bring some cultural aspects for our diaspora folks, or for our people that are also in the continent?
Okay. For me, number one holistic method I use is communication. I have some people that I know that even when I'm going through some things and I've been trying to sort it out, meditating and all, and I still feel the depression, or I still feel I'm not being okay. There are some people I could talk to, friends. Hey, I'm not okay. I think I'm getting them to realize that it's fine to say you are not okay. No, most times we feel, how are you doing? And I'm fine. I can say that to the general public, but there's a few people I can really communicate with and tell them I'm not fine. And it has been helpful. So communication has been so helpful. And another thing with communication for me is I talk to God. Yeah, it's not just a glitch. To me, I personally sometimes, apart from just the regular prayer, churchy something, I have a moment whereby I could just talk to God like as if He was there, you know, just like as if I was talking to myself, but I know somebody is hearing me, speak it out, all the pains and the pressures, and it actually works. Actually works. Another thing I know is doing what you love. I love writing. I love cooking. So when I do things I love, not just because I want to eat, I cook sometimes because I want to feel better. And it's always nice. I write sometimes not just because I have to submit a poem for a deadline, but sometimes just to let out the emotions, and it has been helpful. So something
Excellent.
like that.
Thank you. What about for you, Cynthia? What are some methods that you utilize?
Journaling for me is huge. As sometimes you can't find that person to go and talk to, and sometimes you don't want to talk about what's going on with you. But if you can write those emotions down, and I have found that just writing what's bothering me that day. Hey, it's been a bad day today. These are the reasons why I'm feeling sad. These are my reasons why. Just getting some of those emotions on paper, and then maybe going back later and reading them has been huge for me. Exercise. If I'm not doing at least 3 to 4 days a week of some kind of form of physical exercise, and at 20 to 30 minutes, you're letting all of that pent up emotion come out. And by the time I'm done exercising, I'm like, a lot better. Problem may not be solved, but once again, it's finding those quiet moments, maybe with a little sock and just going within and just getting some deep breathing. I have found that to be very effective for me. And I use a lot of those, like I say, with many of my clients. The physical activity is really good for them, just getting some of that pent out emotion, because as you were saying, trauma, so much trauma. That's the reason why we see so much substance abuse at least in the United States. It's a lot of trauma.
Excellent. Excellent. Thank you. For you, Martina, what are some holistic methods that you integrate into your clinical and personal practice?
Yeah, so I kind of echo a lot of what Cynthia and Ayurveda have already shared. I think for me personally, exercise is my go-to. Especially, being a psychotherapist, it is very stressful. I need to look after myself. If I'm, you can't pour from an empty cup. So even sometimes I work long days and it's like, I just push myself to get to the gym. Gym health club, I don't think about it. I just go there, work this body. And then, using the spa facilities, it's just like, yeah, that's me recharging my batteries, but also connecting with what's important to me, connecting with my values. And I would say, especially during COVID, that's something that I've been a lot more intentional about and thinking about. Am I aligned with my values? Am I aligned with what's important to me? Because when we're not aligned, that's when the kind of distress arises. So kind of, aligning with what my interests are. So that's something that I do. And trying to be more healthy, focusing on my diet, because when you eat rubbish, there are times I eat rubbish, your body responds, it's all connected, and you think, why am I tired? You're tired because you're eating rubbish. That's the reality. And I integrate all of that with my clients that I work with. So all of those kind of different stresses, and some of what Ayurveda and Cynthia have already shared. And I think it's important to kind of acknowledge that, like, you know, nutritional supplements can help. And I know, like in the UK, the NICE guidance, which informs the treatment, which is delivered to people that are struggling with anxiety or low mood, depression, and other, you know, trauma, that there is, I remember reading, I can't remember, a while ago, that like St. John's worts, that can be effective to help with your mood. And I remember when I first came into the field a while ago, people were talking about it, but there wasn't that much of an evidence base for it. But it's actually recommended now, you know, within the clinic, the guidance which is used in the UK. So that kind of highlights that holistic methods are important. The evidence base it's weaker because there's not been as many clinical trials, but we can't ignore that they can and do help people to kind of manage.
Yeah, excellent. Thank you. Yeah, and to piggyback of what everyone has said, I'm in agreement. I think all those things are highly important, and in particular, like I think all of it is important. The communication, like Ayurveda was talking about, because a lot of the times in our cultures, we don't communicate. We repress a lot of the things. So we need to know, when is it that I need to talk to someone that I trust. And if it's somebody, if we cannot find someone that we trust, or if we feel like this is getting, you know, it's increasing, maybe we can seek a therapist if that's available to us. Also, like Cynthia mentioned, food, nutrition, and exercise, and Martina too. I think those are all important. The reason why, one of the things I tell my patients is exercise is one of the most underutilized antidepressants there is, because again, everything that we get from the psychiatrist prescribe underneath that little bottle, we have access to that also naturally. Not to say that people don't need medications. Some people do need medication, especially to get that booster. But what we do know, that the number one thing to treat depression is behavioral activation, basically simply meaning doing activities that you enjoy and that gives you value and reinforcement. So physical activity, when we exercise, we release serotonin, dopamine, which is the same thing that you find in the bottle, right? So also when you have social connections, you're also releasing oxytocin, which is a feel-good hormone that helps us attach. And that's why sometimes hugs feel so great, is because we release that hormone. Also, I'm a big proponent of physical activity and sunshine, right? I'm originally from the Caribbean, and although I'm in the West Coast and there's a lot of sun too, even when I was living back home, a lot of us are vitamin D deficient because we're spending so many time working indoors. So we're not getting enough sunlight. So vitamin D is something that it's a hormone that's really good for our mood. And anyone that's of African descent, here in the diaspora, it's harder for us to get that vitamin D, particularly because of the lifestyle. So I also advocate for people to go out into the sunshine, in nature. Also, I call it green therapy. Nature is such healing. So going, I know for myself, since I deal with clients, to heal myself, I like to go to nature, whether that is to the mountains. If I'm back home, the water is very healing. And it also connects you to your spiritual self, because you see, wow, look how beautiful this mountain is. You know, like you see the beauty of nature. So, and also I integrate nutrition, like you all noted, it's highly important. A lot of the times, when we eat or overeat, it's because that food is giving us, for example, junk food makes us feel good in the short term, right? So that's why a lot of the times we're seeking that food or substance. But in reality, food can be very healing, and particularly, and now they're doing some more research here in the US. Unfortunately, the US, it has I cannot speak about the UK, I'm not there. They don't even recommend such herbs here. But being from the Caribbean, where naturally we use a lot of herbs and supplements to help with things, that's also important. I know when I was a kid and I would get anxiety, my mother would make me chamomile tea because I would get test anxiety. So chamomile is a very soothing herb. So I will go to take my test and she was like, let's breathe, and here's your chamomile bottle. So I used to feel like more soothing. And I have also studied Ayurveda, which is a holistic science from India. So there's things such as ashwagandha and other herbs there. When you study that holistic method and medicine of India, they also integrate yoga, meditation. They integrate plant-based meals and herbs, and also of African descent and indigenous descent. We have that too. It's just that it has been told that it's primitive or not evidence-based, but there are some research out there that are showing that some of these methods are beneficial. We just cannot depend. I think, like my mom says, everything to an extreme is bad, right? If I'm highly depressed, taking some herbs, and I have had a lot of trauma in my family, and I'm just drinking tea away, it's not going to be enough. It has to. That's why we're talking about integrative, right? I go talk to my therapist, and that is the trauma and the symptoms are being processed. Then I might go out and do some physical activity, be in nature, and then I can take some of these herbs, do your research, such you can do chamomile, ashwagandha, holy basil, all these amazing things to kind of integrate them together, and then and eating healthy, and then that's what brings about health and wellness. So when I talk to my clients, I always ask about the trauma. I also want to know what are their health, what are some of their diagnoses that they have for health, and also like what's their lifestyle. And then based on that, then I create a treatment plan that is in alignment. So I might say, oh yeah, I noticed that you're struggling with diabetes. So do you know how the chronic stress and the fight or flight active suppresses insulin, right? So I explain to them how the body works under stress and trauma, and then how long term, because when we have stress and trauma, the whole body is activated. And just like a car, right? If you overutilize it, it's going to break down. So if you had trauma in the 70s and you're having that fight or flight response, your heart eventually, you might have some cardiovascular difficulties, some GI, gastrointestinal difficulties. So I bring that all together, and I still collaborate with other disciplines. I don't know it all. So I might refer somebody to a nutritionist if they need, especially if they have an eating disorder, if they need like a meal plan or things of that nature. So excellent. So talking about evidence-based treatments and kind of working within systems, right, that sometimes may not take into consideration our culture. What do you think are some of the pros and cons of, here in the United States at least, there's a big focus on evidence-based treatments. What do you think are some of the pros and cons of that? And if you don't have awareness of evidence-based treatments, that's fine. You can just tell us maybe how is the mental health in the country that you're in. So maybe we can start with you, Ayomide.
Okay. One of the pros of being having safe space, right?
Yes,
That's what we are talking
evidence-based.
about.
Yes.
Yes, it's just that when everybody is conscious, like we are conscious, people around us are conscious that mental health is important. Having a safe space would be, we are not just creating a safe space for ourselves, others are also creating that safe space. So it's like our community have a safe space for not just discussing mental health, but we are even being kinder. We are being caring, and more concerned for not just ourselves but for another person, because it's not just, this issue with mental health is not just about mood. Some people could be so happy and looking so fulfilled, but they are not fine. So, but when we make our environment, our workplace, our family, the church, everywhere to be safe for ourselves and for others, it will surely be very good. So that is a pros, because it helps a better community. And the cons of it is, I think it's more about how we still perceive this, because we still need to correct some, should I say, narratives. There's still some wrong narratives that need to be corrected. Some people feel the more we are being aware about this, the more we talk about this, it's just as if we are being classified. It's some people feel it's more of a problem being generalized. I don't know, like still in African settings, sometimes they feel talking about it. Why will you say that? Why will you know, that should be private. But sometimes it doesn't have to be private. We just need to be open and allow others to feel safe.
Oh, I was saying that I'm in agreement that I didn't realize I was muted. In agreement, right? We have to create these safe spaces for ourselves and also for our community. And actually, that's the biggest evidence that shows is about the relationship. Forget all the methods, the relationship that you have with your provider or with somebody that you trust and love, whether it's somebody in your community, that is highly important. Without community and social support, everything else won't function. So excellent. So for you, Cynthia, what are some of the pros and cons? I know you're also in the US like myself. There's a big push for evidence-based treatments and outcome measures and all that. So for you, what are some of the pros and cons for such methods? She frozen.
It's important for us to have some evidence-based treatments for helping individuals that are going through some mental health issues. I think our problem is that many of us, we get evidence before we want to try. Mental health is a big concern in the African American community. Thankfully, things are starting to turn around a little bit, that we're actually starting to talk about it. It's been so long that this is something that is in the closet. It's, shh, we don't talk about this with out of the family. Hey, this is a family issue. You don't need to take this to a therapist. Why do you feel the need to talk to someone? Go to church and talk to your pastor. I mean, and do not, once again, spirituality is also very important for us. But we reach a point where we need to, especially if it's been ongoing for so long, that you need to reach out to someone else, to someone that knows the different things that they can help you with. Evidence-based is very important. Cognitive-based, the CBT, I work very much with this in the substance abuse centers that I work with. Cognitive, but it's getting folks in the door, and especially African Americans, because we do not talk about our problems. Mm-hmm. This is something that we can handle, or we can talk to our family, but we do not talk to someone else about what's going on with us. Fortunately, it is starting to open up. We're starting to see more and more that we're handling this well. We need to talk to someone. Thankfully, that some big name people are out and talking about their mental health concerns. I think it was wonderful what happened with, I don't want to say wonderful, but Simone was a big wake-up call. Mm-hmm. That she actually said, I need to step from competing because I'm having some mental health concerns. Seeing these big name, well-known, out there in the spotlight, people admit that they're having some problems. It's been huge for the mental health community. Now we're starting to see going on with us. Evidence-based is very important, but when it's all said and done, we need to cut this curtain that we are separating ourselves from and start talking about, yes, you know what, I am hurting. I do need to talk to someone, and it can't be just someone in the family. And our family members, when they see that a family member is hurting, hey, maybe you need to go talk to someone. I'm not qualified to talk to you about this. maybe you need to talk to someone and encourage them. Hey, have you heard what? That she's going to see a therapist. Hey, I can't believe that she's doing that. We need to stop that. And once we start doing that, I think we're going to start seeing some big progress within the African American community.
Excellent. Yeah, and I'm in total agreement. It's the same for Latinos, African Americans, and individuals of the Caribbean. There's so much stigma, right, when it comes to mental health, and the reason being, right, because we have dealt so much discrimination and so much racism that you also feel like, can I trust this individual? Because I'm not sure about other areas of the world, but it's always being looked down upon to show your weakness, because it can be utilized somehow against you in the system. I know that a lot of the parents that I have, when I was working more within the community directly, that was their fear. Like, are they going to call Child Protective Services on my family? They're going to take the kids away. So there's a lot of fear still, and also being told to just put on a bright smile and keep moving forward. Something that I say always is mental health is health, right? So we wouldn't just go to our pastor if our appendix is about to burst, right? We're not going to tell our pastor, hey, like, I need a prayer right now for this appendix. It might be helpful, but, and your mother, even your own mother, my mom's in the medical field, she cannot take out the tools and operate on me right then. I need to go to a doctor. So the same thing when it comes to the mind, that it's great to communicate with our family, our peers, our spiritual community. But when we realize that it's feeling like it's getting heavier, to identify, to go in and get help, because, mental health is health. So what about for you, Martina? When it comes to evidence-based treatments, what are some of the pros and cons of that modality?
I think, like Cynthia said, I'm all for evidence-based because I'm a cognitive behavioural psychotherapist. So, I should be. The evidence base is important because, when you're working with people, they want to know, is it going to work? And I think it really helps with kind of developing a relationship with, a therapeutic relationship with whoever you're working with, and depending on the type of individuals, some people are kind of more mental, cerebral, and they'll be asking you, so, what is the evidence base? How long is it going to take? And if there isn't any research, what are you going to say? And it's about, you've got to keep your clients on board during that journey. And I think having the evidence base, the science, the research is what can also increase confidence in whoever's engaging with a type of service, as it is in the medical profession. When you go to the doctor, I'm not just going to take, I'll be honest, medication that hasn't been, that there hasn't been a lot of clinical trials, not at all. And I do take, but I've taken a lot more in the past, medication for my physical health. So for me personally, I want to know what the research is. I'm not saying that I'm not kind of an advocate or proponent of holistic methods as well, but I am very much, that's what's been drummed in me. My background is psychology, so I think it's really important, but it's all about getting the balance. And when I was kind of thinking about today and preparing it also made me consider all of the research that's been conducted. You've got to think about who are the actual individuals who are engaged with the research. Most of them are white individuals. So some of the research that has been that's been kind of conducted, it's application to the Black community, the diaspora, or to even other cultures. It's not relevant because a lot of these studies are students who are white, middle class. That is the reality. So we've got to bear that in mind. So there needs to be a more diverse representation of the community at large. And that's why we need more Black researchers who are actually interested in this area. Most of the researchers are male, middle class. So they're researching on what their interest is. And we need money. It's about the money. You need money, funding for the research to be conducted. So with some of the other holistic methods, they could be just as effective, but because there isn't an evidence base, it's a lot more difficult to, I guess, to kind of utilize them. But as you shared, in the US, it's all about evidence-based, key performance indicators, outcomes. It's the same in the UK, and it's money. If you want money from the government, they need the research. They're not going to give you money for just an idea or something that might work. No, that's not going to happen. So yeah, I think evidence-based practice is fantastic, but we've got to acknowledge that there are lots of other approaches that work. And then also acknowledging that within our history, we've got a fantastic history. And like you were sharing earlier, Dr. Jemina, you were sharing about some of those kind of holistic remedies, kind of acknowledging that yes, we can use them, and nothing's wrong with that. It's about trying to take an integrative approach, and there are case studies available in terms of the effectiveness of certain methods. So I think sometimes it's use the evidence base, but then if you are interested in holistic methods, think about, well, maybe I might just try this out and see if it works for me. If it doesn't, then you just keep it moving. Simple as that.
Mm-hmm. Yeah, I'm definitely in agreement with that. I'm also training a lot of evidence-based treatments myself, especially for trauma, eating disorders, and anxiety disorders. So I have a very strong evidence-based background, and that's my main job at the hospital. That's all I do. It's basically doing cognitive behavioral therapy, CPT, which is a trauma protocol, prolonged exposure. About to start learning biofeedback. And so, yeah, so I like everyone noted, evidence-based research it's needed, right? And particularly we need to study. I love neuroscience because now I can say, hey, this is how exercise is beneficial. This is how yoga works. This is why site therapy is important, because it rewires the brain, the neuroplasticity. So I think it's very important component of the mental health field. And it's also important for our people to know that we do have evidence-based treatments and research that does show that it's highly effective. It's a lot of times even more effective than medications. Usually say medication and therapy alone. It depends on the disorder, but therapy is the root, right? If we don't address the root of the problem, it's very difficult. So evidence-based treatments are excellent. However, they do have their limitations. Like Martina, Cynthia, and Ayurveda were talking about, some of the weaknesses is, right, that is basically based on a Western model, right? There's not a lot of money or interest or research being put on researching some of these holistic methods, particularly if they come from African, Black, or Indigenous folks, right? It's before it was seen as pseudoscience, but there's a lot of research now that is showing that. Something that I do is I also look at the literature of other countries. I look at some of the literature that is coming from the African continent. I look at what's being done in Latin America, especially because in these continents, Africa, Latin America, and Caribbean, we are doing our research. It's just that it's not being promoted as much and it's not being taught. So I went outside to get that knowledge, because then we are doing that research. It's just not being highlighted. I know in my case, I do have that advantage that I speak Spanish and English, so that's beneficial to me. But I know a lot of us from the diaspora speak multiple languages, so we might have access to the French literature, to other indigenous languages. So I think that's important. The evidence is there. Use evidence-based treatments that are beneficial. Like I always start my clients with mindfulness and grounding to kind of help them, but then I go on into a full-blown evidence-based treatment for trauma, and I see it work. Before, when I didn't have those tools, it was helping. It's beneficial. Therapy helps everyone. But then when I was using these evidence-based treatments, it's like a vehicle that got you there quicker. But then I supplemented it with holistic approaches, like, hey, by the way, let's check on that nutrition. by the way, if you're not going to feel better if you're locked up at the house in your house with some shades, let's go out, let's do some exposure exercises, let's go to the supermarket, let's go out and about in society. So I think the best modality is using evidence-based treatments in conjunction with holistic methods if you feel comfortable, and also researching that holistic method. There's some things that I would not recommend because there's not a lot of research is there, or it's outside of my scope. It's also important to know your boundaries. So for me, it would be, oh, let's work on the eating and the new and the community support. But yeah, and like Martina was saying, we need more researchers of color, whether it's in the US, in the UK, and in these Western societies, to do research also, but get money, because we have a lot of ideas, a lot of things, but there is a glass ceiling, and there are some barriers to access to education. That's why there's like less than 1% of doctors, psychologists are Black, and I think one, like less than 5, but it's like 1%. And I myself, I'm Afro Latina, so it's like, what's that percentage, right? But there's a lot of historical things that is also keeping us from getting to these levels, and also when we do get to those levels, to be able to have access to the research. So I think the community needs to do better, and I will hope that in the African continent it gets excited about mental health and does a lot of research. So then for us here in the diaspora, we can also connect, because I feel like connecting to your roots, it's also important. For me, it was very empowering to connect back to my ancestral roots of African ancestry and indigenous, and combine that, because you don't know where you're going if you don't know where you're coming from. So for us diaspora folks, I think it's important to also have that connection and that bridge. So my next question and final thoughts. I was wondering if Martina or Cynthia felt comfortable to and either Ayurveda to explain what is a whether it's holistic or mindfulness, what is a tool that you can kind of leave our audience with, so that they can take that. If you feel comfortable guiding us through a meditation, or if you feel comfortable just sharing one tool, I think that's also important, because sometimes people don't have access to go to a therapist. So what is a little nugget or book maybe that you would recommend, so like a resource to give our audience? So we can start with you, Ayurveda. What is a little tool that you can give as a gift to our audience?
Okay. Something came to my mind as we were discussing the evidence-based practices. I feel in the medical field and the scientific world, there are some situations that come up that could be unusual, new. The challenge is for care providers, the people, the health care providers, to be more cautious, even if this seems unusual for a patient to have this. I think the beauty in the science world is coming together to share the ideas, to share researches, and see how we can prefer help. So no matter how it is, if it has been following a trend, if it has been um, commonly seen, or if it's even a new case, I think we should take it as important as we would treat cancer and other health issues. And also, it is a challenge for researchers to focus more on Africa. We need more African researchers, because just as we see other aspects of medical world being developed, we also need the mental, health being extensively researched. And yeah.
Yeah. So thank you. Any little tool, Ayurveda, any little tool that you could give our audience of that has been helpful to you, or that you know it might be beneficial for them to have in their coping tool? I tell my patients, like, let's build like a little coping box. What is a tool maybe that you can put in our coping toolbox for our audience to take?
Okay, taking a break. It's okay
Yeah.
to take a break sometimes. Like, so okay. Sometimes we could feel guilty when we are so busy and having so many responsibilities, but just a short break, and then rest, relax. Sometimes just wake up and sleep. By the end of the day, you know you are going to get stronger and move on. So it's okay to take a break.
Thank you. Thank you. I think that is very important. We have been a community. I used to say I have 500 years of tire in me. It's starting with colonization in the Caribbean, but our mothers often did not take a break, and we saw that model. So I'm glad that you mentioned taking a break. And I think somebody mentioned the Olympics. So many of our Olympians said, you know what, I'm taking a break for my mental health, because that's part of being holistic, right? What's going on in my mind and my body, and what does my body need at this moment? And if it's a break, if it's a nap, that's highly important, because a lot of the times we push that to the side. But I always check in, like, how am I feeling and what do I need in this moment? So thank you. What about for you, Cynthia? What is a coping tool that you can put in our toolbox for our audience?
I would like to piggyback just a little bit on what Agamina was saying, taking a break. As women, we're not supposed to take breaks. We are strong. We are strong women. We can handle anything that life brings to us. We need breaks as much as anyone else does. It's not a sign of weakness. If we can get that drummed into our head, that taking a break, admitting we need help sometimes, is not a sign of weakness. We can start getting that into ourselves and our next generation. Imagine what our girls and women will be in the next generation. My little tidbit: breathing. All of us, if we know, we shallow breathe all the time. Taking that, hold it, and then let it out. If we do that a couple of times, one, it slows us down, and it allows us to focus. And the next thing you know, hey, maybe what we're worried about is as big as we thought it was.
Excellent. Thank you so much. And I think we all breathe, right? And it's bringing consciousness and awareness to that breath. So thank you so much, Cynthia. What about for you, Martina? What are some coping tools that you can add for our audience?
I think for when, if someone's kind of worrying or overthinking, if you're going into kind of a new environment or a place where there's uncertainty, is always, rather than thinking about what's the worst outcome, looking at countering it with, well, what is the best outcome? So you can have, a balanced and realistic outlook and perspective. And that just helps to kind of bring you back to, kind of managing your mindset, because sometimes, if someone is worried or anxious, your mind just takes you on this negative path and journey. But when you're able to acknowledge the positives, that just helps to ground you and helps you to kind of regain control and to reset. And then I kind of alluded to it earlier, the kind of grounding exercises, which are, you can just implement them anywhere, but thinking of 5 things that you can see, looking, for those who are listening, 5 things that you can see in your environment, 4 things that you can hear, 3 things that you can feel, your clothes on you, your hands on your shoulder, 2 things that you can smell, and 1 thing that you can taste, and just constantly doing that. And then maybe, integrating that with the breathing as well, and just using that to help you to be grounded and to be present. And to enjoy life, enjoy the moment, enjoy the weekend if you're not working. Yes. Yeah, they're my tips.
Excellent. Thank you so much. And I really love all these tools, right? As we see there's so many tools available to us. Something that I will add too is also there's so many good apps these days, right? If you have access to a phone and can download an app. I know that there's an app that I use called Insight. I'm not promoting them, I'm not getting paid for that. It's called Insight Timer. And there's so many YouTube, right? There's so many talks like these ones available there. So you can go in and find an app like Insight Timer that's for meditation. You can go into YouTube, use technology. Don't let technology use you. So also there's so many great books out there. So also books, podcasts. So those are some things that you can do. A method that I use that kind of integrates a lot of the techniques that you all have said is I tell my clients the stop method, right? So when you're feeling triggered and worked up, you say stop. Stop is to help you interrupt the stressor. Then T is for taking a breath. So take deep breath, like Cynthia said, inhaling for a deep breath and exhaling, and then pausing and continue. The reason why we breathe is to kind of help us to ground. And also when we breathe, we send oxygen to the brain, because when we're in fight and fight mode, the brain is in the emotional center is activated, but that breath brings us back to the center. And then the T is think. So what is your thought? What is your emotions? And what is my physical sensation? So like Martina was saying, I'm having a thought that I'm not safe. Okay, I'm feeling anxious. Where do I feel that in my body? I feel butterflies, my hands are shaking. But then you can ask yourself, is that thought realistic? No, that thought is not realistic. I'm in the supermarket and there's a lot of people. I am safe and protected. Okay, is that helpful to you to think that way? No, it's not helpful. So then the P is proceed to do something aligned with your value. You know what? I'm going to proceed to go buy food for my family because I love them and I want to make them a whole healthy meal. So again, so you incorporate a lot of these methods. So stopping, taking deep breath, observing what's happening within, and then challenging that, right? Because if we just let it, you can go, the challenging is the CBT way. Mindfulness will say, okay, I'm having a thought of anxiety. Thank you for letting me know. No, but I'm cool. I'm going to keep shopping. With mindfulness, we don't judge it and we don't even question, and we just observe it and acknowledge it with compassion. But sometimes we need to challenge it. It just depends on how strong that thought is or where we are. But that's a little coping tool. Use the media, use the apps, and there's a lot of tools out there, and that's kind of like the stop method and knowing when you need to go get help. So thank you so much, ladies, for being here today. Any final thoughts? So we're going to go ahead and wrap up our show for today on holistic methods for mental health and mindfulness. Any last thoughts that you would like to leave us with?
I'd just like to say that it's okay not to be okay. And it's a strength to seek help. It's a strength. It's good to seek help. And that, is a quote from Michelle Obama as well. Seeking help is good. So seek it.
Yes, thank you.
Okay, and everything is going to be fine. Actually, it's not just a mantra. When we calm down, when we seek help, when we trust God, when we consider everything about us, like everything being balanced, it's going to be okay at the end of the day. So.
Thank you. Any final thoughts, Cynthia?
I'm sorry, I had to find my mute. Being strong means asking for help.
Yes, excellent. Thank you. And I'm in agreement with all of that. We being strong does not mean that we do not have things that we need to cope with. Again, we are all human and we all have experienced physical and mental health difficulties, and it's okay. Strength is, as you all said, is knowing when you need that help and where to go seek that help that will be of benefit to you. That's going to help your higher self, right? So thank you so much. It's been a pleasure to chat with you all. It's great that we're doing this for our community, and thank you. And I hope you all have a good weekend and see you all soon.
Yeah,
Bye.
thank you. Bye.
No problem. Bye-bye.